Hello, I'm Guldemond. I'm a professor of healthcare and public health affiliated to Leiden University Medical Center as well as the Medical University in Gdańsk. And my daily work is transformation of healthcare systems across the globe, working from a policy level on to real implementation in real settings across countries. For me, health ecosystem is a sort of setting with different actors and stakeholders at different levels. So you have government, governance, you have payers, regulators, agencies, supervisors, and then you have providers, healthcare professionals, as well as you have communities with citizens, patients, and you have companies, industry, so it's public and private, and they're supposed to work on improvements, on innovation, either for social improvement like healthcare improvements, it might be business impact, economic growth oriented, or it's more science focused, or a combination of those three. I think the current challenges in health ecosystems is how to manage all the different actors and stakeholders towards impactful, very practical solutions which are needed by patients and so-called end users, to management in the sense that so in the process of development and where you have all kind of different interests and also people speaking different languages, so how do you manage that process in a very efficient, effective way? I think there's a challenge still in acquiring funding, investments for activities, and to have a good understanding about the whole spectrum of funding, investments, whether it's more product oriented or it's more process oriented, is it European or other sources? So this type of knowledge, and also how to translate this into projects, is challenging, as well as also if you have success and you can bring things to the market, how do you get revenues in a fair way to all those who have contributed? The sort of business models is, I think, still quite complex, especially if you have a bit asymmetry between, for example, multinational and a small startup. So how to do this in a proper way, so that's still a very challenging thing. And then, it might be the last thing, and this, how do you manage, let's say, commitment and involvement of the different actors, and how do you have a sort of local government or a funder, as well as patient organizations? How do you connect with communities and how you build a sort of infrastructure with communities, within communities, to do research, real world action research, real world data, also how you connected this to other relevant parts in the system. So I think it's a challenging job to do this, and to make it successful is not easy, but we have some good example as we have here in Galicia. Well, I think RIES is a very good example of bringing people together and exchange experiences, ideas, and work on relationships in a very, I think, inspiring way. You can feel that the sort of warm context between people and re-involvement and energy. And that's very, in a very lively way, and that's I think you don't see that often, often you see this innovation conferences, which are nice and a nice presentation, and some things can be quite nice. But usually, it's more like a sort of business thing, and you go there to listen. But here it's also a sort of local community which just meet, and they celebrate all together in working together what they have done. So that makes it quite special.